Next on Call, alcohol use and abuse.
If you're not willing to learn, then how are you going to change?
And ways to overcome addiction.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
There's the valve.
All of them together.
And which was healthier, the yogurt and the bagel?
All right, I'm going to start by measuring the size of it.
You could also add grilled chicken to this recipe.
Blow hard, blow, keep pushing.
Just your head.
Pull red handle to open bag.
Hello and welcome to On Call. I'm Tammy Watson. Alcohol use is common in our society, and it carries with it many dangers. Heavy drinking can lead to liver damage, increase the risk of certain cancers, and increase the risk of death from car crashes, homicide, and suicide. Pretty serious stuff to consider when all you want to do is sit down and relax with a glass of wine or a cup of beer. But an understanding of the health impacts of alcohol use and abuse is something that we should all strive for. And to that end, tonight we're going to talk about this. We're unable to take your phone calls tonight, but we've got a lot of great information prepared for you. We'll take you to a residential treatment facility located in eastern South Dakota and bring you a report about violence and alcohol problems in teens. And as always, our panel of physicians will explain what we really need to understand about tonight's topic. With me in the studio are Dr. David Bean, Dr. Deborah Johnston, and the On-Call medical editor, Dr. Rick Holm. Dr. Holm, before you introduce our guests, I think one of the main themes of tonight's show is recognizing when an individual has developed a problem with alcohol consumption. When you're with a patient, are there things that you see that help you point this out to somebody that maybe they need to keep an eye on their drinking?
That's a million-dollar question, Tammy. I mean, many people who do have a problem are denying it. They don't want you to be bringing it up. It's not to say that I shouldn't think about it every time. And to recognize it is the first step of being able to help somebody. But the key is for someone to need help, to want help. I don't think you're going to get anywhere until they reach the point that they need, that they want help. Family can help bring them to that. The person can help bringing themselves to that if they have observation enough to look at themselves. The problem is the darn illness helps you cover up the real truth that there's a problem. And when is too much a problem? A million-dollar question.
Well,
That's what we're talking about tonight.
It'll be great to learn what you have to say tonight about that.
That's it. There we go. I'm very pleased to introduce to you our guest for this evening, Dr. David Bean from the Avera University Psychiatry Associates in Sioux Falls, and Dr. Deborah Johnston from the Avera Brookings Medical Clinic in Brookings. Thank you both for joining us. Now, Dr. Bean, you're a psychiatrist. Actually, it was you coming up to me and saying, Rick, it's time we talk about alcohol again. And we've addressed it in this show several times, but it's time to do it again. What was it that brought you to think that it's time and to bring the topic up once again?
Well, there's a lot of alcoholism going on, and there's been a lot of denial about it. And we have teens that are binging, and college students that are dying of binging, and we have people dying on the roads of alcohol driving, and that sort of thing. And I think it's been pretty much ignored much of the time. And I don't think that the physicians of our world pay enough attention to the potential for alcohol use. I mean, the National Institute of Mental Health did a study of people, lifetime incidence of alcoholism, by whatever name you want to call it, is about 26%. 26% of people in a lifetime are going to have a diagnostic alcohol abuse problem. That's a lot.
That's a lot. And we're going to get back to that topic more. We need to find out who Deb Johnston is. Who are you, Dr. Johnston?
Since I'm the person you share a call with, you should know that.
I do know who you are. I was thinking they would like to know that.
I am a physician, a family physician at the Avera Brookings Medical Clinic. I'm one of Dr. Holmes' partners. And I see patients from all walks of life, including a lot of people with alcohol problems that sometimes I'm not as astute at figuring that out as I should be. So I'm looking forward to hear what Dr. Bean has to teach me too.
Okay.
Well, and I think that's it. I mean, could physicians do better?
Absolutely.
And are there clues that the patient and or the family of the patient might be able to give us? But, you know, and we can talk about when is it that we're going to be able, what are the clues, what are the hints, what are the things that we can do to help them? We really need your call. This is an important topic. Oh, we're not going to have a call tonight,
Not
are we?
tonight, but
so we need your call, but you can't call because we've taped this already. So we'll talk to you more about it right after this.
Alcohol can produce detectable impairment in memory after only a few drinks, and as the amount of alcohol increases, so does the degree of impairment.
As we talk about alcohol use and abuse tonight, we want to highlight the fact that there are various programs designed to help individuals overcome addiction. Later on, our doctors will probably be able to give us some good information about Alcoholics Anonymous, one of the better-known alcohol treatment programs out there. But right now, we're going to revisit a story that we brought you last year and look at Teen Challenge of the Dakotas, a faith-based residential program located in Brookings, South Dakota. I met with the executive director of Teen Challenge to learn about their program. Mike Gillmartin, the executive director of Teen Challenge of the Dakotas, works with staff and students in a faith-based program designed to overcome addiction and promote positive personal growth. Gillmartin says that one specific character trait is incredibly valuable in finding success at Teen Challenge.
I'm going to say the key word is humility. If you're not willing to learn, then how are you going to change? And when we talk about substance abuse or addiction issues, you have to change.
Teen Challenge works with men age 18 and older. The men enter a 16-month-long program that consists of personal and work studies with a strong spiritual element. Often, students come to Teen Challenge after getting in trouble with the law, and sometimes they enroll after a court orders them to complete the program. Those who enter Teen Challenge understand, however, that a spiritual emphasis and the Christian faith are key to this program.
We work a lot with the courts. The judges in South Dakota utilize our program often. A lot of judges from Sioux Falls use us. We have offered our services. We go down to the Minnehaha County Jail and we just do a little outreach program there, just telling the inmates they don't have to stay this way, that their destiny is not to be a failure, not to be incarcerated, and quite the opposite. The Bible says that we were created for good works and that we would prosper.
The statistics of Teen Challenge show its value in fighting addiction. Looking at those who have completed the program since 1996, 90% are employed full-time and 81% are drug and alcohol free and have had no further legal problems.
Often our graduates are not only drug and alcohol free, but most of them have a sense of community. They care about helping others, and that's a major way that we help them overcome depression too, by teaching them, you know what, quit thinking about yourself all the time. We don't make his program be about his recovery. We make it be about his whole person. In other words, what's inside that hurts so much? What are you bitter about? What's behind that rage or anger? Really, we're just given that simple message of hope and love. You know, the gospel is about forgiveness and grace.
Dr. Gillmartin's words about accepting change strike home, whether or not somebody wants to embrace a spiritual direction in order to conquer his or her direction, but gaining that awareness to the point that you think you need to change or you want to change. How do you help somebody, or how does an individual reach that point where, because you said during the segment denial is very strong with dealing with some of these problems.
I thought it was interesting what Mike Gillmartin said about humility. You know, to be able to say, okay, could I have a problem? Could I have a problem? Might there be something wrong that's going on? Now that I'm mad all the time, or people are making me feel angry, or people are making me feel guilty, or, you know, could I have a problem? If you've got the humility to say, I might have a problem, maybe I should look into that. I don't want to change what I'm doing. I like what I'm doing. I like it so much. I just love it. I had someone say that to me one time, and later say, I thought I loved it. I'm so glad I'm off of it.
Well, it's a very seductive thing, this alcohol. It causes you to, causes your superego to disappear. That's, you know, what your mother told you, your father told you not to do. Causes your ego to go down the drain. That's what common sense tells you to do. And all you have is what Dr. Freud talked about is id, that I want to do whatever I want to do, and I'm going to drink it till I die if I have to.
So superego is your parental learning.
Yeah, Mom and Dad said don't do that.
And ego is?
When you say, hey, that isn't very smart to do that.
That's it. And your id is, I want whatever I want.
When I want it.
And the id gets the dominance with this drug.
That's right. The alcohol puts your superego and your ego to sleep, and so all you got left is that basic cauldron of emotions that says, I want what I want when I want it, and that's booze.
Well, Dr. Johnston, when you see a patient, do they, if it's somebody that turns out having an alcohol problem, are you like the first one to kind of tune in that maybe they need to think about it, or do they tell you, I think I've got a problem? How does it come up?
Yeah, how does it come up?
There's a variety of different ways that it comes up. Sometimes the patient is there and they may be there under a pretext. They may be there with some, oh gee, I want you to look at this spot, oh by the way. And they may be there thinking that they have a problem that they'd like some help and some direction with. They may be there as the result of an injury or an accident or a health problem that's being made worse by their alcohol use, and that comes up in the course of discussing their problem. Or it may be something that comes up just in the course of a routine exam when we're asking questions about what's your family history, what's your, what work do you do you exercise, do you smoke, what's your alcohol use pattern like? So it can come up in a variety of different ways.
My biggest clue is family disharmony.
Yes. Yeah. How are things going at home?
Yeah.
How are that's often a very big clue that there might be something else going on that you need to talk about, and a lot of times there's alcohol involved.
I had a great case. It's a gentleman who comes in the emergency room, out. Okay, so you admit him to the hospital. I'm on call. I catch. Patient wakes up the next morning, hungover, horribly feeling. I stopped the IV fluids. Had input from family who was just devastated. This freshman, sophomore young gentleman was so inebriated that he could have been dead. And they realized that's a red flag, red flag. The father leaves a message, please, just take a month off. This person was brought in by roommates that said, you have a problem. This person had been going to these parties and would black out and then doesn't know what had happened. This person, I said, this is big trouble. Your life is going, here's two roads diverged in a wood and there's a bad road right there. It's time to go this way. And that this is a problem for you. Saw the person back a week later in my office. Hadn't promised me he wouldn't drink from that. Hadn't drank. Promised his father he'd try a month. He tried a full month. Then he came back another month after that, and he had been drinking some, but hadn't blacked out, but almost once, but not as much. 6 months later, this person who lost 20 or 30% of his weight, who was getting into an exercise program, had completely got off of this whole thing, changed roommates, life was back to order, school was back together, making it class again. Changed his life, made a difference. He saw it. You've seen it.
Let me ask you a question. Did you tell him he had an alcohol abuse problem?
Oh, yeah.
You made him the diagnosis.
Oh.
See, one of the problems is I believe that most physicians kind of walk around a little bit and they say, well, you drink and all that, just drink like that and all that sort of thing. I've only had 3 DUIs. Well, there are
3 DUIs? Yeah.
You know, one may be bad luck, but 2 or more is alcohol dependency, alcohol abuse, whatever you want to call it. But I don't think physicians have enough guts, if you will, to say, hey, I think I got an drinking problem, and we need to do something about that. And now is the time.
You know, sometimes you feel, I'll defend the physicians. Yeah. I'm not going to make this person quit drinking by telling him to quit drinking. I'm going to tell him he's got a problem. I'm going to advise him to quit drinking, and it fails every time. Why do I waste my time doing this? I mean, that's what I hear from doctors. What do you think, Deb?
I think that there's a lot of that thought. I think that we're also handicapped somewhat because when you look at that college student, there's such a culture of alcohol misuse
in
college kids, the binge drinking. They're all out there drinking Thursday, Friday, Saturday night, and it's normative behavior for a lot of those kids. And
abnormal if you're not.
Exactly.
I mean, it's seen as abnormal, not saying it's good.
So they look at it, and why am I different from my friends? Well, your friends aren't in my emergency room needing a ventilator because they can't protect their own airways. That's what's different between you and your friends.
This is not normal behavior. It's average behavior or common behavior.
Yes.
But
that's a good difference.
But poisoning yourself with alcohol, I don't consider normal behavior.
No, it's not normal, and it's not healthy, and it's not good, but it is culturally accepted.
Yeah,
and it's part of that culture.
We're part of the culture. As long as we say, "Oh, you got a little bit of a problem," you always ask about how many packs of cigarettes they smoke. Right.
And I always ask about how much they drink, too.
Okay. And do you ask about how many DUIs and have they had blackouts and intoxication and all that thing?
I've got to confess I don't.
Hey, guess what? Those are clues to alcohol abuse, misuse, or whatever.
Yeah. Well,
go ahead.
I was going to say, beyond the big issues, like you're an alcoholic and you have divorce or DUIs, let's go. You said alcohol is a poison.
Yeah.
Now you wanted
How harmful is it?
Yeah, you wanted to talk and show us some things that demonstrate.
Give us your demonstration. You've got a little chemical. Have you got something to show?
Yes.
Well, I do have something to show.
I mean, we're talking about the toxicity of this particular entity. Oh, what do we have here?
Okay.
Well, that's the brown bag.
Okay.
We assume.
And we got a couple of glasses here, and that's the.
Okay.
That sort of
brand
thing.
New glasses, obviously.
And these are. Can you identify what these are?
These are
eggs.
Eggs.
These are eggs.
Yeah.
Okay. What is an egg?
It's
protein.
Yeah, it's the most elemental picture of what is in our bloodstream.
Okay,
it is
a one-celled organism, right?
Well, yeah, it's a one-cell organism.
Okay.
Yeah, right.
And so our brain, our heart, our lung are made up of eggs, right?
Yeah.
Basically. You know, we got 100 billion neurons in our brain, and then we got many times that glial cells, but those makes up our brain. So what does alcohol do to normal?
Protein.
Protein. Yeah. Does anybody know what alcohol does to protein?
No, it's rather toxic.
Who's going to show us?
Okay. I happen to show you. Now this is Everclear.
Oh.
And Everclear is 195 proof, is 190 proof, 95%. And so we're just going to see what happens when we...
Okay.
Did that splash in your coffee?
We'll have to get you some new coffee. I'm going to scoot this butter container out of the way over here.
So what does alcohol do?
And that camera over there is going to...
Can you see the camera over there?
Yep.
Okay, what does alcohol do? It coagulates protein.
Oh my. That's like it's a Friday
now. And that's instant coagulation. Now, alcohol coagulates protein. All our cells are protein. So if you drink alcohol and bathe your cells in protein, you coagulate protein. Okay, and it kills protein. Now, alcohol kills bacteria. We use alcohol sponges and that sort of thing.
Yeah.
So the more you bathe your cells in alcohol, the more protein you're coagulating and the more cells you're killing. So we know about alcohol dementia, we know about liver cirrhosis, we know about heart disease that comes from drinking alcohol. It's okay on cholesterol, makes your cholesterol die, but it rots your brain. So this is how you get a scrambled egg brain. We could do that same sort of thing.
So the old it's killing brain cells is not a joke, it's a fact?
It's a real
deal. There's no question about it. It's toxic.
So that's what alcohol does. So we ought to drink more alcohol because that's good for our brain cells, our heart cells, our lung cells, our kidney cells.
No.
No, we shouldn't. Now, how much is enough? Or how much is too much?
It's $1 million question, Dave.
Well, it is multi-million-dollar question because all the advertising says, hey, have you ever heard of this is a crappy bar, or this is the unhappy bar? It's always the cheerful bar or the sunshine bar and that sort of thing. Yeah. And when you see the ad for Black Velvet, there's this beautiful gal in Black
and
Velvet.
Of course, the booze is going to bring you that gorgeous girl up there every time.
And James Bond, you remember James Bond, 007, right, and we'll have the martini and that sort of thing. So we're sophisticated and all that sort of thing. So, I mean, if you like things that coagulate your brain cells, if you think that's good for you, why, have booze.
That looks so dreadful. So where does that take us? What do you want to talk about the hardcore damage that it can do to the body, the liver?
Well, I can tell you the reality of taking care of somebody who has chronic alcoholism includes every system. Not only the psychosocial problems that incur, you know, they lose their job, they lose their marriage, but you talk about the person who presents with vomiting blood. You talk about the person whose liver fails and their belly fills up with fluid. You talk about the person, and they're mostly people who have multiple problems, and they're doing several different things. They may be doing other drugs. They also are oftentimes smoking. And Deb, go on, carry it on. What did I miss?
The psychosocial factors I think you can't underestimate, because a lot of people who are chronic alcoholics have lost all their support system. So it's very difficult sometimes to provide health care because they have no way to pay for their medication, they have no way to get their surgery, they have no place to live, they have nothing to eat. And that can be very difficult. But it's really easy to identify the alcoholic who's at the very bottom. It's a lot harder to identify the person who's drinking heavily and it's causing problems in their lives, who's functional, who's making it to work. Maybe they're not performing the way they should, but they're able to maintain a facade of functionality. And I have had occasions where I've been absolutely blown away, where it's come out that somebody I knew very well in my personal life or as a patient was a problem drinker, and they were able to hide it from me.
But that's only hiding it for a while. You know, they oftentimes will have that downward spiral, and then pretty soon people will go, oh, that's what's been happening.
But wouldn't it be nice to be able to find and intervene before that? Right. Wouldn't it be nice to be able to catch all those people when they're at that stage of that young man that you've met in the emergency room before that behavior had become so entrenched and their life had hit that
bottom. And of course, you know, the answer for those people is that they generally have to quit absolutely, completely, always, never again. Wouldn't it be nice, and I'm going to ask you this question, how about the people who are there are a lot of people who are social drinkers that get along, that aren't in trouble. There is data even to say a glass of wine or two a day is helpful in preventing some vascular diseases, as long as it's not more than that, you know, that kind of a thing. What about, when can a person realize that they might be in that downhill spiral, that they're getting into trouble? Well, isn't there a time that the person can say, I am in trouble, and back it up and not have to go teetotaler? Okay, I'll throw that out.
Looking for an answer?
Yeah, I am.
Well, you can ask them how much are they drinking and have them go through a drinking protocol. The National Institute of Alcohol Abuse has said, you know, if you drink more than 4 drinks a day, 14 days out of the month as a male, or 3 drinks a day and 7 days a month, you're a female, then you're above normal.
Toxic. You're at a toxic
You're getting
level.
into trouble. And my advice to people is, if you find yourself having a rhythm of drinking, eye openers, everybody knows an eye opener is a problem, but how about only at the end of the workday? I only do it when the day is over, or Friday nights only, or some sort of thing like that. You know, just drinking a little bit is when you're out mowing the lawn and it's hard out and you're hot out and you're dry in the mouth and your buddy comes over and says, hey, Johnny, let's have a quick one. That's accidental. That's irregular, you see. But if you're having a quick one every day at the end of the work, you're not just socially drinking. You've built a rhythm of drinking, and that's a sign that you've got a problem.
Okay. Well, moving on, we're going to jump to the videotape real quick. The hospital emergency department is often the main point of medical care for some teenagers, and this includes teens treated for injuries from violence or alcohol misuse. A new study shows offering teens a brief, structured intervention addressing these issues while in the emergency department can reduce the risk of future injury. Catherine Dolph has more in this week's JAMA report.
Today, life for many urban American teenagers is a lot harder to navigate. Deciding who to hang out with or even who to play basketball with can make a difference. It can really be tough, especially when dealing with violence and drinking.
Don't try to make the problem bigger where you can make it littler. You can talk to the person about it or, you know, just avoid it.
16-year-old Siobhan Harvey uses those words when talking to other teens about violent situations and alcohol. He's in school, stayed away from the wrong people, and now volunteers in his community.
We aimed to provide a brief intervention during the time that teens are in the emergency department to decrease their future violence and alcohol misuse over the next several months.
We randomly assigned them to 3 conditions. One was a therapist brief intervention. The second was a brief intervention delivered exclusively by a computer with audio. And the third condition was a usual care control condition where they got a brochure.
Doctors Maureen Walton and Rebecca Cunningham from the University of Michigan and co-authors conducted a randomized controlled trial at Hurley Hospital in Flint, Michigan. They studied more than 3,300 patients aged 14 to 18 years admitted to Hurley's emergency department between noon and 11 at night, 7 days a week, from September 2006 to September 2009.
The therapist brief intervention showed twice the reduction in peer violence, peer victimization, and violence consequences than the control.
The computer intervention alone decreased the teens' alcohol-related problems, such as missing school or problems with their family related to alcohol misuse for up to 6 months following an ER visit.
The study appears in a theme issue on violence and human rights in JAMA, Journal of the American Medical Association.
Thanks for answering the questions. Now I'd like to spend some time going over your answers.
You ask open-ended questions as opposed to telling them what to do. What do you think about that? And then following that, you talk to them, you give them some tools for different situations.
It's important as we talk to teens to help them realize that there are ways that it's possible to change behaviors and it's possible to stay out of and get out of risky situations that they may encounter.
The findings of this study suggest that a 30-minute brief intervention can positively change these adolescents' behaviors.
Catherine Dolph, the JAMA Report.
Alcohol cirrhosis is the scarring of the liver and occurs when scar tissue replaces soft, healthy tissue. It is the most serious type of alcohol-related liver disease.
Thank you for joining us tonight. Our show is about alcohol use and abuse, and here in the studio are Dr. David Bean, Dr. Deborah Johnston, and the on-call medical editor, Dr. Rick Holm. Doctors, that last segment used the term intervention, and to me that brings up images of family conflict and people ganging up on you saying you're not living your life right. Does it have to be confrontational, or what treatment, how do you get somebody into treatment?
Let's talk about confrontation. There are these kinds of treatments where a person is at a point where they won't change, and you do a confrontation, or an intervention is what it's called. I always kind of want to call it confrontation because it is such a confrontation to that individual. Have you been involved with that?
Well, I agree with the term confrontation because it really is, but it maybe is a reality test. You know, when you beat up your wife and the cops get called and you got the third DUI, somebody's got to intervene at that point in time. Now, those are way down the line. If you're just drinking on Saturday night and get drunk and go out with other people, your wife may just mad like heck at that sort of thing. And these are problems of living that alcohol is the excuse for going on with. Remember the superego? No superego anymore with alcohol. No ego anymore. All you got is id saying, I want what I want when I want it.
Yeah. Yeah. Deb, have you been involved with intervention?
You know, I haven't. Not personally. I haven't sat in on some. And, you know, it is such a difficult thing. I think that, in general, the more aggressive you are with somebody, the harder they're going to dig in their heels. But most of the time, people where the family is turning to an intervention are not the ones where they've gotten the message from gentle. It's usually a last-ditch effort.
I think that's exactly
and
right.
It is such a difficult thing because denial is such a potent part of the disease. And I think that in order to have any success treating alcohol abuse and misuse at whatever stage of the disease you want, that person's got to have some insight and motivation and desire to change. And without that, just like treating just about anything else, the odds of success are dismal.
Well, I agree with you on that one. I sense that, I mean, we can recognize it, we can identify it, the family can point it out, the wife can come in and say, he's got an alcoholic problem, doctor, you've got to help him. You can say, you know, we've got to slow down, your liver's bad, you've got to realize there's a problem and do all that you can. And if they don't have that sense that, oh, okay, maybe I better do some changes, it's oftentimes very futile, and people have to hit the gutter before they change.
And sometimes even then, they have made the decision that they don't care.
That's right.
That it is still more important to them than their life, their family, anything else.
And my recommendation to the family member, be it a woman or a husband that's married to this person, or a child, is to separate. You know, they can drag you down so far, and there's, you know, you can't. Sometimes you just have to protect your money and your house and yourself, and that's as good as you can do. Dave, your response to that?
Well, there is Alcohol Anonymous, which is the group for alcoholics. There is the Wives or Mates
Al-Anon
program, Al-Anon, and then there's Alateen, and those are helpful to the person who has to live with a person with alcoholism. Sometimes that spills over, and the patient who's got the alcohol problem kind of gets the message, but it is hard to change people. How do you get a patient who's got denial about cancer to take cancer treatment?
Yeah.
Well, there's an old saying, the care of the patient is in the caring for the patient, and if you have a good caring relationship with your patient, you got a better chance of them following your advice.
Yeah.
Well, what advice and how do you treat? How do physicians treat alcoholism?
you know, one is to get them to AA, which is, I think, the very first thing. I also believe in sometimes retreats or a month treatment in one of the treatment programs that we have. We have several in this.
So that's like a residential where instead of trying it at home, I take a break from work.
Right.
I go stay somewhere else.
Sometimes after their third or fourth visit to one of those places. I mean, that's the problem. See, they just come out of it. They come home. I can do all right. They sit. They get that glass of
I can quit drinking
vodka, and they stare at it, and they look at it, and they weep at it, and they say, "It's not going to control me," and then they drink it, and then they're back with it. You know, it's a tough deal.
It's really important to remember this is a chronic disease. This is not strep throat, where you treat it, it goes away, it's cured. This is diabetes, this is epilepsy, this is hypertension, this is heart disease. It's a chronic disease. Yep. And the condition doesn't go away because you've started treatment. It's far more like diabetes. You have decisions every moment of every day that are involved in managing that disease. And like quitting smoking, like the diabetic who goes and has a big piece of birthday cake, people with alcoholism, alcohol abuse problems, slip. They have to try over and over again to quit. I think Alcoholics Anonymous and programs like that are the bedrock of treatment. And when I can't convince a patient to at least make contact and try, it leaves me very skeptical about their odds of success in the long ride.
So bad.
Well, we have medicines for everything, and we do have medicines for people who acknowledge at least I need some help with my drinking, and we've had antabuse, and that makes you sick if you drink, and then we got the other ones now, and that sort of thing. They're supposed to reduce the urge to drink and that kind of thing. But basically, you know, it's a total body treatment, family treatment, and that sort of thing. One of the things that is a very important thing, if you want a patient to be dry, their mate has got to be dry, or their family's got to be dry. And they say, well, I don't have an alcohol problem, so you know, they need to stop, and I'm still drinking. Well, how much are you drinking? Well, I'm not an alcoholic. I said, are you drinking? Yeah. Well, if you're the example for your person who's got an alcohol problem, maybe you ought to stop your drinking.
Yeah.
So that gets complicated, and do you end up seeing, like, you know, the husband and the wife and the kids, the families, to try and help them?
Well, I'm an old-fashioned type of doc. I tell people what I think, and I say, okay, you come in, and this is what you got. You got alcoholism or alcohol abuse or whatever you want, and there's a treatment for that, and we got medicines for that. We've got the AA program. We got, you know, Canton and other sorts of things, and community programs. We have community programs down at our program down in Sioux Falls, but you got to stay with them, and you got to be kindly to them. Say, hey, you got a problem. Let's get it done, and I'll be with you. I'm your doctor. I'm with you, and we'll go for it.
I think there was a key that you just said that's important to me as a physician to see how successful other physicians are with all sorts of diseases. And it strikes me how powerful and important that physician looking at the patient, listening to the patient, and letting the patient know that you as a physician care, and that you're not judging, you're there to help, and that you'll be there through this.
Oh,
I think
boy.
that's
I want to fib to my physician about how much exercise I'm getting. How
yeah.
how am I supposed to be honest? You know, like if I've got a bad habit that I know is not good for me, and
Tammy, that's perfect.
So
we've heard it.
We've heard it all.
We've heard it. We've heard it. We've seen it. We know.
So really, if I tell you the truth,
if you tell me the truth, we've heard it.
Yeah.
And sometimes it's amazing how powerful taking that step, taking ownership is to just make that confidence with your physician. That can be an incredibly powerful step in recovery.
Ooh, unloading. Tell the truth.
Tell the truth.
You got a problem? Hey, here's how much I do drink, and I'm worried.
You're not going to talk about it to your friends at coffee?
It doesn't go anywhere.
Oh, no.
No way. That's medical.
It's confidentiality business.
No.
You're not supposed to
It
talk
is a
about
real
this.
deal.
It is a real deal. And it's something that we take very seriously. For all the depersonified stories that we use to illustrate our points, we take it very seriously that we're not going to tell what you tell us in that exam room. With certain exceptions, if you tell me in the exam room you're going to go out and shoot your neighbor, I'm probably going to tell you. But
I'm going to tell somebody.
I'm not going to gossip over coffee about how much Tammy drinks.
Yeah. Or doesn't exercise.
Or doesn't exercise.
Boy, I'm the poster child tonight for bad habits.
With you, but I'm not going to tell on you.
Now, I wanted to go back a little bit, and the medications used to treat alcoholism is very interesting to me, but also, we can talk about the causes of alcoholism. So where do you want to go?
I want to talk a little bit about the success that Teen Challenge illustrates. It isn't just what I'm not concentrating on Teen Challenge, as good as they are. I'm concentrating on the fact that I think what's really powerful about that group is a mentor that is over those boys in that group that are, however old they are, those young men, that there is a mentor that says, we are not to be, this is how we act, this is how we care, and that we're humble to God. And I think the religious component is a very important factor there, and that's part of why it works. I've listened to M. Scott Peck talk, who's passed away since, but one of his tapes that I've listened to on alcoholism was the religious-based things are helpful. They work. The AA is a religious-based thing. It's giving up your own power, your id, and giving to a superego, that there's a rule that we live in. This is how we work to help other people. It's not about me, it's about them. And I just wanted to add that part, how great it is that we have a perfect example with Teen Challenge, mentorship, male mentor in particular, that says to young men, this is the way we act, and responsibly.
Because if you're in a situation where you see people, your family, alcohol use is common and misuse is common, I guess you think that that's normal behavior, not healthy, not average, normal.
But for people who grow up in alcoholic families, it seems like normal behavior. How does a child who grows up with mom and dad, aunts and uncles, grandpa and grandma with substance abuse and alcohol use problems learn that that's not the way you should be drinking? And there's you had touched on the causes of alcoholism. There's such a strong genetic component to alcohol abuse and misuse.
Yeah, certainly there is that. There's the family that drinks together, stays together type of mentoring, if you will, the negative mentoring, and yeah, we've got some genetic trails. There are certain cultures that don't have alcoholism problem, and if you got a dopamine receptor, the right kind, you never get drunk on alcohol at all. But the major business is the society says it's okay to drink. And the society says it's okay to drink until
you fall down.
You fall down. And if you fall down, pick yourself up, and that's all right. Well, that's why we have 75 or 85% of the people in the prison are there under alcohol-related crimes. That's why we have people dying on the highway because it's okay to drink and drive and all that sort of thing. And it's okay for kids to binge on the weekend and college. Colleges now say, hey, gee, it's not okay anymore. We've got these support groups that we're developing in colleges now. My granddaughter is down at Miami U, and there's a big deal about drinking in college, and that's a big party school in America, so I'm told.
So there's an improvement. Perhaps we're gaining on it a little. I think the emphasis that you heard, though, was that there aren't good major drugs that make a difference. It isn't the drugs, the antabuse or the other medication.
They can be a good supplement.
They can
For the
help
right individual, I think they can be a useful supplement.
Have you had experience?
You know, I have had more experience treating comorbid conditions. There's often depression, anxiety, other illnesses that go along with substance abuse and alcohol misuse. I tend to leave the treatment of the alcohol to the experts.
Oh. but many of these people who have alcoholism or who are so dependent really are self-treating. Some people talk a problem of anxiety or depression or phobia, and they end up hitting the bottle, and then they can't get it out of their mouth.
Or is it that the alcohol is causing that? Certainly, people who have depression, if they keep drinking, it's so much harder to treat their depression, their anxiety. They're so intertwined, it's hard to know which came first, the chicken or the egg.
Post-traumatic stress syndrome. What do you think about that? Is there alcohol as a self-treatment for this panic that they get when they see a little kid walking across the street?
The Vietnam veteran was our evidence of the alcohol related to PTSD, and that was where we first defined PTSD in our psychiatric culture anyway. And, you know, people who had PTSD from the Vietnam War commonly got drunk, commonly beat up their family, commonly lost their job, and ended up down in the lower ends of the gutter as a result of that. Yeah. The problem with alcohol, it's a very effective anxiety relieving device. It really knocks the anxiety down. And it knocks the depression down. Yeah, temporarily. The problem with it is that it's so short active, and when it goes out, it rebounds, so that you knock down the anxiety with the booze, and it's like pushing down on a spring, and then you let it go like that, and it bounces off, and so it's close enough to say, well, it worked one time, an hour ago or 2 hours ago, I better have some more, and that's how that road to deprivation goes.
I love the example of the nasal spray, you know, the Afrin kind of nasal spray where, okay, so you have a cold, you use the Afrin spray. Whew, I'm clear. The anxiety is gone, so to speak. Okay, whoop, 12 hours relief, right? 12 hours later, boom, now I'm just really stuffy, and in fact it's worse now because we've irritated everything, and I've got rebound stuffiness. Throw it again, oh, clear, but now it comes back gangbusters and much worse than before, and I mean, 2 weeks later, when the cold would have all been gone, you know, you're still using the spray, only more and more is needed to get that same relief. It's the same story as alcohol. It's tachyphylaxis. It's a picture of rebound worsening.
Well, addiction is a real physiologic phenomenon of the brain and the rest of the body and the nose in that case. And it is a real physiologic phenomenon, and so to prevent it, you don't want to get into it, because once you're into it, it's hard to get out of it.
You get stuck and dependent, and the withdrawal is the worst thing, and you need to have that alcohol to keep the withdrawal anxiety.
Yeah. We're going to have to wrap up shortly, but you...
I just had my take-home message.
Go ahead, start.
My
Kick it off.
take-home message for people who... I don't have a problem with alcohol. I drink once a week, one drink, maybe. Maybe I don't. Keep it that way. For people who have a family history, be very, very careful about your alcohol use. Be very aware. I think our best bet with alcohol use is not to ever get into a problem in the first place. That's our opportunity, I think, as physicians. Our best opportunity for intervention is prevention. The college students, you're really drinking that much? You know, that you're putting yourself at risk.
That's right.
Dr. Bean?
Is there any good about drinking alcohol? I mean, what good is that for your body? Anybody tell me what's wonderful about alcohol? It rots your brain, hard liver kids, it breaks up your family, puts you in jail, gives you DUIs, it makes your kids drink alcohol. They go down to degradation. Hey, let's have some more alcohol.
Dr. Holm, you got like 5 seconds.
Thank you so much. Appreciate you guys for coming in.
That was
great evening.
Thanks. Great discussion, doctors. Stay tuned. We'll be right back with the Homespun Perspective and then What's New in Medical Science.
Looking for reliable healthcare information online? You can start with the resources link at the On-Call website. From there, you can access a variety of accurate and dependable information sources, including the South Dakota State Department of Health and Medline Plus.
Most of us have seen how destructive the demon rum can be once it gets its grip around the soul of a person and brings him or her to the gutter that is alcohol dependence. But if that individual or the family saw it coming, could the destructive dependency spiral be stopped and independence preserved? Wouldn't it be better to realize the danger early before the alcohol is taken over, so the good of that human being is not lost to drink? Can change happen? These questions seem paradoxical in a world where many social connections seem to rotate around the sharing of alcohol. But it is just then, when the whole world seems to be having a tailgate party, that each of us should consider the danger of becoming dependent on the mood-altering seduction of alcohol. By its very nature, alcohol makes the drinker think things are better than they really are, making denial so much easier. So how does one know when they might be getting into trouble? We don't have a blood screen or a brain scan to know, but there is a set of questions that can help one consider whether or not things are getting out of hand. The Rapid Alcohol Problem Screen, or the RAPS-Q, is a revision of the older screening method called the CAGE. The RAPS-Q works for both sexes and all age groups. When a person answers positively to 2 or more questions, he may have a problem. Number 1, remorse. Do you feel guilt for drinking? Been thinking about cutting down? Annoyed by people asking about it? 2, amnesia. Do you ever have memory loss from drinking? 3, performance. Do you have trouble getting to work the morning after and performing normally? 4, starter. Do you ever need a morning drink, an eye-opener to get going? 5, quantity. Do you drink 5 or more drinks at a time, once a month or more? Now, honesty is the key for this screen to work. Are the answers to the question on that RAP screen showing clues to a sneaky and malignant problem in your life or in one you love? Is independence losing to alcohol dependence? Is it time for a change? Is it? We'll be right back.
Email your questions to us before the show and get your concerns to the front of the line. You can find out how to contact us at our website. Just remember, make sure your question is about the topic to be addressed in the upcoming show.
In our medical news tonight, Tai Chi, that slow motion exercise that's a blend of martial arts training and gentle motion, has been found to help fight depression in older individuals. Researchers at UCLA looked at a group of 112 adults over the age of 60 who had been diagnosed with major depression. For a month, these patients were treated with a standard antidepressant, the drug escitalopram. 73 of these patients showed only partial improvement, and these individuals were then assigned to one of 2 groups. Both groups continued to get the medication, but one group attended a health education class for 2 hours a week, and one group attended a Tai Chi class for 2 hours a week. The individuals participating in Tai Chi reported more remission from depression than the health education class. And the results of this study might prompt you to consider how both exercise and group activities might help in boosting an individual's mood. And in other news, back to the topic of alcoholism. A recent report from McGill University in Montreal suggests that the drug naltrexone, if I'm pronouncing that correctly, also called Revia, is more effective in certain people, those with a specific genetic variation, and women. This research is useful because study along the lines might be able to help doctors determine whether or not a drug may be of real use to an individual, or if taking it may be a waste of time. The scientists involved in this study say that further research needs to be done to identify and continue to identify which populations will be best served by particular drugs. And that's all the time we have for tonight. Remember, On Call is rebroadcast on SDPB Digital Channel 2 Mondays at 11 a.m. Central and Wednesdays at 4 p.m. Central. Once more, I'd like to thank our guests, Dr. David Bean, Dr. Deborah Johnston, and as always, our medical editor, Dr. Rick Holm. And thanks to you for watching and being here with us tonight. Have a good evening.
Avera is a proud sponsor of On Call on South Dakota Public Television.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
To learn more about life and health, you can order your copy of The Picture of Health, a beautiful book containing insightful essays and evocative images by on-call medical editor Dr. Rick Holm and Dr. Judith Peterson. This book, containing healthcare advice, stories of medical history, and meditations on healing, can now be yours for $17 at the South Dakota Ag Heritage Museum. Call 1-877-227-0015 to order. This offer is made by Ag Bio Communications at South Dakota State University.